Ehlers-Danlos is fairly new to me. Tracy was diagnosed in 2012 and I've been working with her ever since. So until she was actually diagnosed, we didn't actually know what we were dealing with, just that we knew there was something not quite fitting here. And she was at times severely debilitated and sometimes not so badly debilitated. So having her diagnosed was really important. EDS in New Zealand is relatively new. And there doesn't seem to be a hell of a lot known about it other than what Fraser has been teaching us. So it's been a huge learning curve for all of us. And Tracy has been dogmatic in finding out about Ehlers-Danlos and the treatments that are available for it overseas, and the Kevin Muldowney program, which is her physiotherapy program, which is doing wonders for her as well. So it affects all the connective tissue in the body. So what I treat is I keep the joints in place most of the time. But before she had the strengthening exercises and the prolotherapy with Fraser, she was actually falling to bits again just as quickly. It's caused by accidents, life, doing what life does. She would fall or trip over or go for a bike ride or dance, and something would fall out of place if she made the wrong movement. So what I was doing with her weekly was putting her back together, basically, so that she could live a bit more. Yeah, basically I put her together, put things back in place, because when a joint is out of place, it's putting pressure on a nerve supply and a blood supply. In order to heal, things need a nerve supply and a blood supply to work properly. Well, my role is really, in treating Tracy, one of keeping her functioning optimally. I knew absolutely nothing about EDS, so when she diagnosed it, I thought, what on earth is EDS, and it's been a whole learning curve for me altogether. But it's also been a learning curve to be part of a multidisciplinary team, and learning about EDS, you've got to really go to Google and look it up. There's not a lot in my reference books and things about EDS at all. Even in the medical ones that I have, there isn't a lot about Ehlers-Danlos syndrome. So it's just been a whole learning thing. I knew nothing and now I know more. And I think we'll just keep on learning. So for other people treating Ehlers-Danlos in our profession, it's a matter of finding out about what that particular person has, what problem areas they have, and what you can do to fix it, basically. You're never going to cure it, but you need to keep these people functioning optimally. So osteopathy, a lot of people think it's about bone crunching, but really with people with Ehlers-Danlos, you need to do it very gently if you must bone crunch at all. I tend to use a lot of muscle energy and muscle release techniques instead, which are much kinder to the body. The changes I've seen mostly in what's happening with Tracy have mostly occurred since Fraser and Emma started. Because I was trying to manage her on my own, it was very difficult. Because of the nature of the disease, things didn't stay in place once you put them in place. You'd only have to do one slight thing and everything would fall out of place again, and I'd be back to square one every week. Since the prolotherapy and the physiotherapy have come on board, she has improved out of sight. It's been absolutely amazing to see her grow and recover, and I can just keep her together to a certain degree, but with the strengthening and the therapy into her muscles and joints, it certainly has improved her outcome.